Well, welcome back. In the first 5 minutes of the show, we try to lay the groundwork, bring you a little bit of history, look at the numbers as far as the Hollywood Casino is concerned here in Toledo and the casinos around the state. But as we said, it was an elephant in the room talking about gambling addiction when these casinos first came about here in the Buckeye State, and want to get into the crux of our conversation here this afternoon, talking with Lori Lewandowski, Scott Akers, and also Kathy Andros, representing the Wood County ADAMHS Board. Associate Director Lori Lewandowski joining us again. Scott Akers from Behavioral Connections of Wood County, and also Kathy Andros from Harbor. Before we talk about gambling, I want to talk about Harbor and also Behavioral Connections of Wood County. You guys joining forces, I mean, would you call it that, joining forces in how we treat mental health here in Northwest Ohio?
We're absolutely joining forces.
Yeah.
Behavioral Connections for years has been a provider, the largest provider of mental health and addiction services in Wood County, and Harbor is
the largest provider of the same in Lucas County.
Yeah.
So now we're joining forces. We're going to be better together. We both have different strengths and complementary strengths, so we should be better together.
Yeah, and this is kind of it's not so much an overlapping of issues you both address. You have specialties in some areas, you have specialties in others, and this is really a good marriage to continue on with something else that sometimes needs mental guidance. But you guys have brought together your strengths in two different areas, correct?
That's right. There are large areas of overlap between the two agencies, and yet there are also areas that Harbor has expertise in, that Behavioral Connections does not.
Yeah.
And we bring some strengths to the table that Harbor will benefit from.
And you used the word Harbor as a verb, and you didn't even pay him to do that. That just happened naturally. So very, very good choice of words there. You guys were patient enough. The magic of TV. Folks at home didn't realize you guys were sitting here as I was talking to them at home, talking about the casinos and the issues there. But Lori, let me bring you into the conversation. And as we look at the gambling conversation, 2 years ago, it was all about how, this is great for the economy because the revenue that these casinos are going to turn out, but then there was the downside to gambling and the addictions that exist. 2 years in, as we sit here today, what is our read on gambling addiction here in Northwest Ohio, you think?
We are establishing the read. It is a new field. It's only 2 years, and so research tells us it takes about 4 years before the problem statement is really defined as how many people would be suffering from gambling addiction.
Let's delve into that a little bit. You say the specialists, the experts say it will take 4 years before you start getting a real read. What is the read? I mean, what signs, symptoms, what are we looking for in trying to determine, okay, 4 years in, now we're seeing it?
Okay, the signs and symptoms are multifaceted and defined in the DSM-5, and I could really let the treatment providers probably speak a little bit more efficiently to that because they're on the front line with this. So I don't know if you want to comment.
Scott, has there been a true definition as far as what we're looking for?
There is. We've actually had some changes within the field in how problem gambling is defined. It used to be defined as an impulse disorder, and now it's being defined as an addiction. And so that's new, and a lot of that results from some of the brain studies that they've been doing.
What's the difference?
An impulse control, the way that gambling addiction was previously seen as an impulse control disorder, it was seen as something that people had this impulse to do, and they were uncomfortable because they had this impulse to do it. And until they did that, they weren't going to get comfortable. So, one of the similar disorders is this obsessive compulsive hand washing. You're just uncomfortable. You feel like your hands are dirty all the time. As soon as you wash your hands, you feel better. And that's why people wash their hands a lot. And then that feeling starts to build up again. With addiction, it's actually pleasurable, and it's something you're going after because it gives you feelings of well-being. And there's some brain information that I can give you on that too, about how that works.
But it's different from, I guess, and Mark, correct me if I'm wrong. In alcohol addiction, you drink and then you feel worse about it later. You're saying there's that instant gratification about gambling.
That's right.
That's what you're trying to tie in. Similar to like a sex addiction.
That's right.
There is that initial, surge where you feel good about yourself. But you're saying gambling is on that same level?
It is. So they've done brain studies, and that's one of the new things. Is over the past 10 years, our ability to do studies on the brain has really skyrocketed. So in the center of the brain, there is a series of connections which is sensitive to dopamine, and it's called the reward center of the brain. So when somebody drinks alcohol or uses a drug, or we think has sex or eats a really good cheeseburger, though the dopamine floods the system.
Okay.
That happens when you gamble too. So it's actually a system that in some instances is very helpful. It's what teaches us, to eat. It's what teaches us to do healthy things.
One of the things that I came across over the last couple of weeks, we have over the last couple of years, for that matter, Kathy, we've reported how there has been this established sign-up sheet throughout the casinos where if you feel you have a problem, you can self-report yourself, and they will keep you out. Now, this is all well and good, right? This is fine. This is. Well, go with that. What are you saying in theory? Why is that not so strong of a program?
One of the hallmarks of any kind of addiction is that people often hide their use. And so to expect them to walk into the casino where they get a payoff or reinforcement, and speaking of that dopamine center, part of behavioral conditioning means that every now and then I get a reward for my behavior. Well, say in a casino or in other forms of gambling, every now and then I might just win a little something. Or I watch somebody else win something and I think, oh, if it happened for them, it can happen for me. Activates that same part of the brain. And interestingly enough, there are different rates at which we can reinforce people's behavior. We can do it every time they do what we want, we can do it on a random basis, or we can do it intermittently every 3 times or every 5 times.
Right.
Which one do you think is the most reinforcing?
Probably the first.
Every time?
Yes. Was I wrong?
I'm afraid so. Actually, random reinforcement
I didn't know
is
there
the
was going to
best.
be a quiz today.
Random reinforcement is the best. And if
Yeah.
you think about it, that's exactly what happens in a gambling situation. Every now and then you get that little fix, if you will. There goes that dopamine reaction,
Yeah.
and there you have it. What we look for is people hiding use from their loved ones. That would definitely be one of the hallmarks. And so very often people are more open in talking with clinicians about substance use instead of gambling.
Talk to me a little bit about, as we saw the conversations in 09 and 10 talk about casinos coming to Northwest Ohio, coming to Ohio. Is there that get ready mode as far as mental health is concerned, that this is something we're going to have to be ready for? We're going to have to be ready for this influx.
Absolutely. You have to come out before the problem.
Yes.
And you have to study. what
Proactive, not reactive.
Exactly. And you have to study your baseline data. Like, what are those other states seeing that have casinos? And how might that be affected here in Ohio? How might that play out? So you've got to look at that.
In Wood County, that effort has been led by our mental health board. We call it an Adams board in Wood County. It's called something different in Lucas County. But Lori and the Adams board have taken leadership in helping us train clinicians and providing levy dollars for providers to train clinicians to be able to confront this problem, as well as initiating a research effort so that we can tell the extent of the problem in the county and how the problem is changing.
Isn't it? And I want to go back to something that you said earlier, Lori, talking about waiting 4 years. That's frustrating. That's frustrating to think that it's going to take 4. There could be somebody out there right now, and I want to put out there to folks as well. We are not here to be anti-casino, anything along those lines. We are addressing. That's just like if we came on here and said there's a cheeseburger group out there, as you brought up, and we're not anti-cheeseburger by any stretch of the imagination. Had a great one last night. I won't go into that. But talk to me about that frustration that we've got to wait 4 years before our definition comes out as to who is treated, when they're treated, why they're treated. Am I reading that right?
Well, you are. And certainly, I guess we fear the unknown. That's just normal. But then you've got to bring your data in. You've got to make it a sound approach to treatment and a sound approach to prevention, because they're both important in this. And 2% of the profits from the casinos go to all the ADAMAS boards. And by the way, ADAMAS stands for Alcohol, Drug Addiction, Mental Health Service Board. Here in Lucas County, it's the ADAS Board, Alcohol, Drug Addiction Services Board. So every county has one of those. They receive 2% of the dollars. And Ohio Mental Health Addiction Services is leading the charge to help us to really develop a sound system, a sound approach.
So sitting here today, we can't say that X number of people, because of the, or not because of, but due to the casino's opening 2 years ago, effective this summer, we can't say X number have been treated for gambling addiction, correct?
That's right.
That's right.
But can we say we are seeing people who are addicted to gambling?
Yes.
Yes.
And how do you treat them?
Well, obviously, one of the treatments is to, understand the behavior.
Let me
underneath
stop
it.
you for a second.
Sure.
Let me ask a better question.
Okay.
What are you seeing? What does it take for a person to self-report? What is that? What brings that person to you to say, I have a gambling problem, I need to address this, just like we see with all the other addictions we've brought up?
It can be a number of different things. It can be a friend or family member, significant person in the person's life who says, look, you have an issue, you need to go get help. It can be the person themselves saying, oh my gosh, I just spent the rent money again. And I want to make clear, it's not just because a casino exists or a racetrack exists.
There are other ways to gamble.
There are millions of people out there who drink and use alcohol responsibly. You can go to a casino and have fun and walk in with the intent of, okay, I'm spending this amount of money and I'm done and that's it. And they don't have issues. But there is that small percentage of the population who can't control that. Those are the people we're talking about, and those are the people we're trying to find.
Our last, I wanted to point out too, our last report that we had, and I may have pointed it out before, not just said the number, but some 1,000 people around the state of Ohio had put themselves on that self-reporting list to be kept away from the casinos going into them. Sky, you were going to say?
Well, what our assessments are showing is quite a number of people who are having more trouble with scratch off and lotto, and really spending everything. People who, we have an individual who spent his daughter's entire college fund on lotto. So that's another issue that we're looking at as part of this gambling issue.
Where do the wires get crossed? I mean, from a licensed social worker perspective, where do the wires get crossed as to, we all have that itch occasionally. It's like, oh, I really think I could, that Mega Millions, that Powerball gets up to 200, 300, 400 million, whatever, and there's a chance. There's a real good chance I could win it, right? I mean, we've all been there, but what is it that crosses the wires that brings somebody to that point where I am going to forfeit my child's education fund?
We don't know exactly what it is that gets people to that point. We know that once you reach the level where you're having a problem with gambling, that there's already stuff going on in your brain that is different than people who do not have a problem with gambling. It can be a genetic issue, those things feed in, as well as people who have other kinds of addictive disorders are more predisposed. But we don't really know what it is that would make one person and not another person into someone who has disordered gambling.
I wanted to show people a number of outlets online, and we'll scroll through them with you. GamblersAnonymous.org, one of those places to go, and representing what we have here today. As we pointed out, the Wood County Alcohol, Drug Addiction, and Mental Health Services Board, as well as Harbor, which you can go receive information there, harbor.org, and also behavioralconnections.org is another outlet if you are seeking advice or possibly help along these measures for any type of addiction. When we talk about treatments and we continue with this conversation, if somebody's out there listening today, Kathy, and they say this is kind of striking a chord with them, what kind of steps do they need to take as far as getting the help they need? You said it may be a family member, it may be a friend who has brought it to their attention. Maybe they're just sitting there at home today and it's all of a sudden, yeah, maybe I do need to get some help.
Pick up the phone and call us. That's what we're here for. They can sometimes come in through their employee assistance program, so their employer may actually offer free counseling, and we can get them started on the road to helping themselves. Or they can call up any one of us, either Behavioral Connections if they live in Wood County or Harbor, and we will make sure that they get the treatment they need.
Are you seeing insurance cover things like this for a lot of people, especially when you're considering different types of addiction, or is it all kind of thrown into one lump?
Insurance will usually cover this.
Yeah, well,
I mean, it's a diagnosis within our manual of diagnoses, so it will be covered. And I also would like to point out that if people want an appointment, they can walk in to Behavioral Connections 4 out of the 5 days per week and get an appointment right then.
Lori, I want to give you an opportunity. We've got some props out here on the table and also some pamphlets which are available to folks, which they can read up on some more information as far as learning about addiction and learning what outlets are out there.
Absolutely. These are stress hockey pucks, and they have the boards 419-352-8475 number in them, and they're actually designed to be given out, especially at the Wood County Fair, which actually starts this weekend.
Yeah.
So, and then we have the brochures as well. And actually all of the treatment providers carry those brochures too, because that's a handy little thing just to pick up and look at. And you can actually read on the inside, what are some of the warning signs? Mm-hmm. Because I think most people don't present with this as the initial problem. I think we see it after we get them into treatment.
When you see the branches, if we can go back to the brochure for just a second, and you see the branches, you've got phone numbers and access to not only local resources, but state resources and national resources. Should people start locally, or, I mean, can they jump right to a national number and try to get help? What's the best course? Doesn't matter. Just get help.
Get help.
Get help.
Just get
Yeah.
help.
Yeah.
Just get help.
Doesn't matter at all. And do you guys, like there's a big group meeting, from a local, state, and national perspective, is there some cohesiveness there as far as what's being offered?
Well, that's the whole point of a merger like ours, is the integrated care for our clients. I mean, more and more through, obviously the Affordable Care Act, but just, health in general, we're trying to provide more integrated care for people. So anytime we can combine services and do a more effective job, it's a win-win for everevering involed.
Let me
Also,
ask.
there's been advancements in the field in the past 10 years that, due to the training dollars that we've received through the levy, we've been able to send clinicians for specialized training. So we have people who are specially trained to address gambling addiction.
Let me
And
go ahead.
that training actually was provided by the state, who really wants to professionalize and make a system of care very workable for people and clinicians. But actually you will have to have 3 trainings added on to your licensure in order to be certified in gambling treatment.
Is it, I guess, unsafe to assume that Cleveland, Columbus, and Cincinnati are all having the same conversations we're having here today, you think? I mean,
I would
do they
think
have the
so.
same outlets in those cities?
I would think so. Most
Yeah.
of them have local boards. There's 53 in Ohio. So I'm sure that those boards are starting to charge on this.
Let me ask the tough question as we have just a few remaining minutes. Is enough being done right now as far as treatment and access to treatment is concerned?
That takes us into prevention. I think we need to look at our younger population under the age of 18. Now, you have to be 18 to get into the casino, but we're finding that many of these young people are presenting into treatment in our Children's Resource Center, and they're talking about gambling online. So they're being primed, so to speak, for the bigger ante or the casino, that type of. So what we want to do
Well,
is
social media connections. There are gambling pop-ups all over the place.
Absolutely, absolutely. So like a social norming campaign, such as the one we started, we have billboards, don't let the game play you. And it's just sort of getting people thinking again about the problem.
What about the age factor and it getting younger and younger?
Well, one of the things that we know about how this brain angle works is that the prefrontal cortex is the part of you that gives you self-discipline and can help you control your behavior. That's underdeveloped even into the age groups of 20 and 22 years old. So that is affected by gambling, and it's tamped down, so it's not really responding in the right way.
Do we need to get more of a message out to the young people?
Absolutely. Absolutely. They get primed with games that are very colorful and hold your attention, and and then the casinos are kind of the same thing.
Yeah.
They're very bright and colorful, disorienting. You don't realize how much time you're spending there, so it kind of like smooths them right into that path.
Kathy, Scott, Lori, thank you so much for spending some time with us here on the Roundtable this afternoon. We'll be back right after this.